Okay, let's get started. Um, Welcome. It's 12:02. We'll go through a couple of things. It's so nice to see everybody sharing where they're from and also what made them happy this week. There's some really interesting science around how people's expectations of what will make them happy and not turn out not always to be true, and people tend to make the most of most situations. So, um, really special to be with you guys. I am um, calling in here from an office building in New York City. Normally, I would be alone, or normally there would be 50 other people in this office as FreeWill, and instead, it's just me. And in fact, I'm only one of two people, it sounds like, in the entire 25-story New York skyscraper. We're here in the intersection of Broadway and Canal Street, for those of you that know New York. It's where Chinatown and Little Italy and Soho and Tribeca meet. And normally it's this incredibly bustling intersection of people from all around the world. And now it's basically silent. I actually walked to work today because it's better than taking the subway or taking an Uber or anything else. And so it was stayed 6 feet away from everybody. And it was uh, pretty remarkable to see how quiet New York is. It's the quietest it's ever been in my lifetime, certainly. And I think probably in many lifetimes for most people. So welcome. Thank you for being here. I know that some of you are balancing infants on your lap right now. Some of you are chasing after dogs. Some of you are chasing after third graders. Some of you are in a closet or in a small room because your partner or your spouse is on another phone call somewhere else. Some of you might have the laptop on the kitchen counter while you're making lunch. All of that is totally fine. And so welcome, welcome to you all. And I'm really glad to be with you. Quick housekeeping notes. Everyone has been muted. That is for your sake and mine. There are already 570 people on this call and 1,000 people that have RSVP'd. So that number will continue to climb. Really exciting, but also knowing all the chaos that's happening in your homes and in your life. Everyone's on mute. So the best way to put questions is in the Q&A form, which is separate than the chat. There's a little button that says Q&A. Use that. I will do my best to monitor it. Last week, I had two colleagues in the office with me helping out. My colleague Simone is helping out from her apartment right now, but it will be a little bit more back and forth between checking the Q&A. Those folks are safely home right now, so just me here, so please be patient. If you want to chat to the whole group, in the chat button at the bottom, it says all attendees. Otherwise, it will just go to panelists, which will be me and Simone. We'd love to hear from you, but also if you want to share that with everybody, make sure to do that. We'll answer questions at the end. As I said, it's going to be a lot to manage with so many folks, and there'll be a lot of questions. And then, we'll do 5 or 10 minutes of questions at the end, and then we'll pause, we'll end the call, we'll send the recording out after, but I'll also stick around here on the Zoom for another 10 or 15 minutes to get a few more questions. I assume that there's no way we'll get to everybody's today, but just so if you have something burning, make sure to include it in the Q&A. We'll do our best to go quickly through them. And if not, what we did at the end of last week is go through all the questions at the end so we could bring it forward to you this week as well. All right, so today's agenda, we'll do some quick introductions. We'll actually share feedback from last week's webinar, what went well, what didn't, and what we're doing differently today based on that feedback. We'll share some updates from around the nonprofit world. We'll talk about how donors are reacting and what we're seeing there. We'll walk through some recommendations and some resources that we've made available for you, and we'll do next steps in Q&A. So here we go. Thank you again for being with us. So my name is Patrick. This is me in an office that is currently totally unoccupied. I'm the co-CEO of FreeWill. I started FreeWill alongside my wonderful, brilliant co-founder, Jenny Xia Spradling. Back when she was just Jenny Xia. She's been married in the 3 years that we've done this. My background has been in digital fundraising. So I helped run email fundraising for President Obama. I was the head of innovation at change.org and helped grow that to a couple 100 million users around the world. Jenny brings a lot of other expertise. Was around the top of her class at Harvard University. She's brilliant. She also helped start the impact investment fund at Bain Capital. So a lot of the work that I'll be presenting is hard work that Jenny did. But moreover, our team is just unbelievably wonderful. And back when we could crowd in small spaces, this is us. So 55 wonderful people working really hard right now to help make you guys successful. $1.2 billion raised in committed bequests. That number is going up day by day. In simpler times earlier, we were named top 50 philanthropists in the world. So really excited to be supporting you and your work. A lot of amazing engineers, designers, fundraising experts, lawyers, et cetera. And right now we're totally focused on this. So just a little bit more on FreeWill right now. So as I mentioned last week, our head of operations is an amazing, brilliant Chinese-American woman named Celia. Celia's family is actually from Wuhan. And so we've been tracking this pretty since the beginning and watched the spread and began to think about what this meant for the nonprofit world, what this meant for the US earlier than most. It is also the case that as a startup, we are used to moving extremely quickly. We're used to dealing with rapidly changing circumstances and so on and so forth. We know at the same time that most nonprofits are not used to this level of speed and this level of changing environment. That is totally okay. The reason you can build a great institution is because you are consistently great over a long period of time, not because you zig and zag as the moment changes. So that is a normal process. When we talk to partners and we talk to nonprofits, almost universally, they'll say things like, hey, we work slower than most nonprofits. Nobody ever says we work faster. So it's a slow moving world and that's okay. But in this moment, we're trying to help you navigate a situation that's moving with unprecedented speed and to help your organization continue to survive and thrive at this moment. All right, so let's talk about you this week. How are you feeling? What are you to? Well, 950 people in the nonprofit world, primarily in planned giving, but not exclusively so, signed up for this webinar. These people are from the US, Canada, the UK, Australia. The folks in Australia will be listening to the recording as it's 3 a.m., but good morning to you on the West Coast. Good afternoon to folks here on the East Coast. Good evening to the folks in the UK, and good morning when you listen to this tomorrow to Australia. You're also working really hard to support your organizations. And you're also, while you're faced with personal anxiety and a rapidly changing environment. So this is just heroic work that you all are doing. I assume that some of you are becoming stay-at-home teachers in an unexpected way. Some of you are caring for older relatives or even potentially sick relatives. We know you're watching out for your families, watching out for yourself, and that's a lot of mental strain on top of a rapidly changing environment where your organization is counting on you to be excellent here. And so we see you and thank you for all your hard work. We did ask what people were worried about this week. We asked this last week as well, and so it's interesting to see some shifts. 38% of you said we're worried about not being able to hit goals. This is down 13% from last week. 38% said we're worried about the health and safety of coworkers. This is also down considerably. People are starting to get more certainty around actions that they can take. 42% of you are worried about the health and safety of donors. This is also down 15% from last week. People are starting to see more actionable impact here. 23% said you're worried about potential layoffs or losing my job. We see the economic impact starting to shape in people's heads. This is up 13% from last week. And then 23% of you said all of the above, which is about the same as last week. All right, well, what else is happening? So 62% of you are feeling anxious. That's totally understandable. I think a lot of our team are as well. I'm certainly feeling that from time to time. 31% of you are also eager or energized. People see this as a moment to make a big difference. We'll talk more about how donors are feeling in a moment. 19% are happy. It's a resilient bunch. And 15% are lonely or isolated. So we see that and totally understand. Before I jump on, actually, two more housekeeping notes. One is I'll keep my video on this whole time, which is different than last week, so that if you're hard of hearing and you need to read lips, that's there. If you are hard of sight, I will be reading a lot of the slides, so you won't be missing much. We'll also be sending out this recording afterwards, and that recording will get up very quickly. The YouTube will have captions on it, so that can help also if you're hard of hearing. I know sometimes I don't enunciate enough, and I'll work on that today. Okay, so we had a great session this time last week, and about 500 people joined. Got some overall great feedback, and I wanted to share some of what we heard so that it will shape what we do going forward. So first, the summary of this is just a quick recap. We said, please don't hold events or donor visits, and talked about the reasons why. We talked about how you'll be successful if you keep marketing. We talked about being thoughtful and creative, using what we call the triple option, which is extremely effective tactic to be able to message, plan giving, and other types of giving in crisis. We talked about some of the best practices on phone calls. We talked about how using low quality video will be a way to authentically connect with your donors. We also just talked about how this is a moment to learn quickly and that we're in it together. The recording, which a lot of people appreciated, is on this page. That first letter is an L. We'll drop it in the chat, and we'll send it along with the recording as well. So if you did not make it to last week's, we'd encourage you to actually go back. There's a lot of interesting tips there. We won't be repeating those this week because many of those folks are the same, and so we're making sure it's all new content this week. But there's a lot there, and I would encourage you to watch it. One tip is that if you're watching on YouTube, the recording, you can watch it at 1.5 times speed or double speed if you want to get it all in quickly. Thanks, Simone. Simone just popped in the link to the resources page that also has the recording. So if you want to click on that and save it for later, go for it. Okay, so what went well last week? Well, overall, the average rating on how helpful was this was a 4.6. Most people rated it a 5, 30% rated it a 4, and a few folks rated it a 3. So that was really good to see. The feedback we got was roughly this. Thank you for doing this. I felt anxious. Now I feel energized. That is exactly what we wanted. So thank you for sharing that. Someone said, nice to have a plan I can share with my team and to know that other people are trying to figure this out and we're all in this together. That's also great feedback. And then someone said, this was so much better than I expected, which is both flattering and a little insulting, but I know what you mean. And so thank you. It was funny to come across. Okay. Also, we asked people, hey, we're going to do 4 more of these. Would you like an invite? And of the 245 responses, 245 said yes. So that was really confirmation to us that people are really hungry for more resources, more strategies, and we'll continue to do this. Okay. But also, we can do some things better. And this is actually the most important type of feedback, so we can know what to shift for this week. So we're always hungry for feedback. Here's some of what we got. Hey, we need more samples and templates. Phone scripts would be good. I need to know how to talk to donors. Let's talk less about what's happening in the world. We can read the New York Times and we can read the CDC. Instead, just give us more tips. So we shortened that version this week, and we'll go longer on tips and tricks. More clarity on event cancellation timelines. This is a big thing weighing on a lot of people's minds. So keep an eye on that in a moment. And then say more about what to do if our work is not COVID-19 focused, which is a big question that we're hearing. So we'll get to all of these today. Thank you for this feedback. At the end of this session, we'll drop in a survey. Please, please, please fill it out. It will help us shape this, what to do next week as well. So we want to make sure that we're delivering the type of content and resources and strategy that are most useful to you. Last thing, a mea culpa, is that last week we promised that we'd get the recording out in a few hours, and because Zoom's servers are overloaded, it actually didn't come back to us from Zoom for a day and a half. That's how long it took to process the recording, because so many people are working from home for the first time. So we have a whole new process this week. So many of you said, where's the recording? I want to share it with my colleagues. I want to share it with my peers. So we have a new process, and we should be able to get it out within a few hours this time. So thank you for being patient with us last time. We are learning at light speed on how to do these excellently. All right, let's do a quick run through of what's happening in the world so we're all on the same page. And since we last spoke, as you guys know, this has moved at light speed with an exponential curve. A couple things have happened. 163 million Americans are under shelter-in-place restrictions or similar. This is in 17 states, but some of those states are some of the most populous in the country. Tax filings have been delayed until July 15th. The stock market is down 35%, and a recession does look likely. Technically, a recession is negative growth in 2 consecutive quarters, so we can't possibly see an official recession until, I believe, the end of June, but we may know that it's coming much sooner than that. New York Governor Andrew Cuomo and others suggesting some restrictions may last 9 months or more. Not that we'll be in total lockdown, but there will be shifts for a longer period of time. And then stimulus checks, potentially $1,000 per adult or more, looks likely. If this happens, we'll fold this into a future conversation about how to turn that into a fundraising opportunity, because many people will not need those checks. Certainly many people will, but how to make the most of that, that may be a big moment for your organization that you'll want to be ready for. So as that happens, check back in and we'll share some more tips on how to make the most of that. One other note, just to give you a sense of the global scale and how quickly this is moving, is that 20 minutes before we started today, the Prime Minister of India, Prime Minister Modi, said everyone in India, a country of 1.3 billion people, has to stay in their homes for at least the next 3 weeks. So just an unprecedented situation that we're looking at. But at the same time, and we started to see this in the chat before the call, that people are being creative and energized, and they're looking for connection and impact. So Louis Vuitton, the high-end luxury brand that makes a lot of fragrances, is repurposing a lot of their factories to start making hand sanitizer. Author Mo Willems is hosting a live stream doodle every day for kids and parents at home who want to stay occupied and interested, etc. And so really interesting. And then one thing I've really enjoyed is our own team is running twice a week yoga. That our colleague Megan, who's just brilliant, was one of our first teammates, lives in Austin, is a professional, not a professional, but a highly trained yoga teacher. And so she's been delivering yoga classes for our staff for twice a week as a way to build connection, get everybody exercising and moving, which is really, really fun. And actually, one thing that we wanted to do is that if you want to join these yoga classes, we'd love to have you. And so Megan's up in the top right. Sometimes her dog is rolling around in the background. You know, it's not perfect, but it's really fun and really excellent. So in the survey that I mentioned, there'll be a question. And if you want invites to 8:30 a.m. Tuesdays, 4:30 p.m. Fridays, we'd love to have you join for yoga if that's something that you're up to. So I'm not in this picture, but I will be joining on Friday as well. It's a great chance to stretch out and also just be together. Great. Let's talk about how the nonprofit world is changing. So last week we said, are you working from home? And 50% of people said yes. This week, 93% of people are working from home. So in just 1 week, we've gone to effectively total work from home for most of the nonprofit world. And this is really stunning turnaround. We also asked people, are you more or less effective working from home? And a lot of people are getting used to this. A quarter said the same, about a quarter said a bit less, about a quarter said a bit more. Some people said much less, some people said much more. It's netting out to about even, but it's really interesting to see. On our own team, people are feeling more productive, but more isolated and more lonely. And so we're looking at ways to more foster connection. A lot of people are without a commute, without a lot of chatter during the day, they can get so much more done, but also it's hard. And I think as the weeks wear on, it might be a little bit more difficult. Christine asked how and where are we supposed to answer these survey questions? We sent this out on Friday, or maybe over the weekend actually, and so if you hadn't signed up by then, you wouldn't get it, but we still want to bring this information to you. We'll send these out for next week. Cool. And we also asked, are you still doing donor visits? Last week, half of people were still doing donor visits. Now 92%, basically everybody, has said no, we're canceling donor visits. 5% said we don't do donor visits. So overnight, we've gone from, in 2 weeks, we've gone from everyone doing events and visiting to half of people doing events and visiting to working from home. And now everyone's working from home and there's no donor visits. Big questions here. When will fundraising events restart? We know this is the top thing on many people's minds as they try to plan out the full year. So we asked your predictions, and then I'll give you a little bit more insight into how we're thinking about this. First, when do you expect to start doing this? So 20% said in 2 to 4 months, 25% said in 4 to 6 months, In 21% said in 6 to 9 months. 27% said I have no idea, which may be the best answer. And then some people said in more than 9 months. I want to share our best estimates. And what this is based on is looking at other countries and how they've progressed along the curve, what's possible here, and also calling to mind the population that we are looking at. So we'll go a bit slowly through this because I know there's a lot of context on this slide, but let's just start from the far left side. So 0 to 3 months, these events are not happening. And you should be aware of that. If you get a chance, cancel the event. 3 to 6 months, we also think it's very unlikely. And so you don't have to cancel it yet, but I would make no purchases. I wouldn't reserve event space, wouldn't put any deposits down, prepare to cancel this. 6 to 9 months, it may be less than 50%. And we'll get into why that's true in a moment. And so what you actually want to do is not necessarily cancel it, but treat it as plan B. And make sure that you have a plan A to continue to hit your fundraising goals and to do all the work you want to do in the absence of that event. 9 to 12 months and beyond, TBD. So we wouldn't necessarily make purchases. We would just put a calendar note and reevaluate in 3 months as to when you're going to do this. Now, this might seem a little bit conservative for people, but let's talk through why this is the case. So events with high-risk populations will be the very last events to return. And if your donors are in their 60s and 70s and 80s, which is the case for most people, note that this is going to, even if you are back to work, even if public transit may be turning back on in your city, or in a more driving city where restaurants and bars are reopening, there will still be a lot of caution given the low likelihood of vaccine in the next 6 to 9 months. And so these events are going to be the single last things to show up. You should also expect that even if you have events, attendance will be lower. It may also be the case that small businesses or other potential corporate sponsors are going to be drawing back on their ability to do sponsorship. And so just keep an eye that this might not be the solution you're looking for. But if you are able to have an event in 6 or 8 or 9 months, and you haven't put as much preparation into it as possible, that is okay. It's okay if you have less time to prepare. Remember that expectations will be radically different. There's an old George Burns joke that some of you know. George Burns is a comedian who lived to be 100, and in his later years, he would say, I'm happy to be here, but at my age, I'm happy to be anywhere. And when we talk about events in the fall, in late summer, in early winter, people will say, I'm happy to be anywhere at this point. Not just happy to be alive, but happy to be in a community. And so if it's not your typical Met Gala extravaganza, that will be fine. And just remember that the expectations for any event in 2020 are drastically different than they might have been in early January. And then note is that this timeline may be similar for donor visits with older people. So if you are, if you're under 60, if you're back circulating the population in a few months, it may still be that you pose a risk to older donors, and it's going to be unlikely that you'll want to go to a nursing home or a retirement home or even visit someone in their late 70s or 80s. So just keep this in mind. Many people, by the way, that we talk about, what they're thinking about now is, okay, I'm canceling my travel, canceling my event budget, but what I'm trying to do is actually protect that budget and make sure it doesn't get removed from my budget going forwards. And so they're thinking about other interesting ways to do it. And you might want to keep that in mind. All right, let's talk about how the world is changing for donors. So like you, many are feeling anxious or lonely. Many are under shelter in place or similar confinement, so they're home and they're there and they don't have an ability to go anywhere. And they're also worried about economic fluctuations. The stock market is up 6% today. It was down 5% yesterday. Who knows what it will be tomorrow? They're worried about job risks. They're worried about economic fluctuations. So we'll know that that's the case. But they're also deeply connecting with loved ones and old friends. This is a video hangout that a lot of people are participating in. And I taught my own parents how to use Zoom on Thursday. We had a great time. It took a little bit to get them used to it, but they really enjoyed it. And people are really hungry for connection in a way we haven't seen in a while. They're also, even though they're anxious, they're hunting for ways to help. So in this case, we see church volunteers delivering groceries to elderly community members. In Brooklyn and Manhattan, we're seeing a huge outpouring of volunteerism for people bringing food to those who can't go out safely. And what we actually see here, and this is important, that that as people are feeling anxious, they're also feeling inspired. And these positive and negative emotions can live at the same time in the same person. And actually, what we're also seeing is that when people are having impact and being able to help others, it is reducing their own anxiety. I've seen it firsthand from our team, who is feeling less anxious, still anxious, but less anxious because we're able to put effort into helping you all. And that's a big shift. I'm sure you'll see that with your own organization and with your donors. People are saying things when we talk to donors like, I know there are people hurting more than me, so I'm doing whatever I can. This is a big moment of stepping up and civic engagement, even while some people are also drawing back. We'll talk in a moment about how to interact with people who may be feeling uncertainty, but still may want to help. And at the same time, and this is really important for the plan giving folks on the team, interest in estate planning is at an all-time high. So I shared this graph with you last week that searches for estate planning is at the highest ever been in the recorded history of Google. Now, it's also the case that when we look at our own website, and this is some insight into private data from FreeWill, this purple curve, which you can see, is the expected bequests in March. The blue curve is bequests to date, but because the month isn't over, the purple is expected overall. And just to put this in context for you, that first big spike you see on the left, that's when FreeWill was on the front page of NewYorkTimes.com. The second big spike is when the AARP magazine, which goes out to 30 million plus senior citizens and folks over 50, who are not all senior citizens, featured FreeWill. So 30 million people got an article about FreeWill in the mail. The next one was some big spike around end of year giving. And yet, without any major press story or any other big effort on our part, we're seeing that March is the highest giving that we've ever seen. So if your executive director wants to pull back on planned giving, you can show them this graph and say, actually, people are making more planned gifts now than they ever have. It's because they have more time and attention, etc. Okay, so that's the context. Let's talk through some extremely practical next steps, and I hope these are really helpful. So how to be thoughtful, kind, effective, and safe, which is our mantra for how we're operating in this moment. So let's talk about how organizations are shifting, and this is data from you. 45% of you say you're increasing digital outreach and digital giving, so almost half. And we're seeing a big increase in phone calls, so 59% are increasing phone calls, and then 41% say, hey, we don't know yet, which is okay. This is a fast-moving experience, and we hope that some of this is helpful in your planning. Let's talk through how to make the most of phone calls. We went through this last week, so I'm just going to recap it very quickly. Donors are more likely to answer the phone than any time in the last 15 years. You can check in on donors and update them how the organization is changing. This will be a welcome conversation. And then third, and I really love this tip, and a lot of people wrote in saying we love this so much, is that you can actually schedule time to go on a walk, a virtual walk with your donors, where both of you are on a cell phone, walking safely in your own neighborhood. And it's a really great way to connect with people. But let's go a little bit more granular to say what this looks like, especially not knowing who's feeling secure and who's feeling ready to help in that case. So what we want to do is think of this as a two-part strategy when you're calling a major donor or even a small donor. You have so much time these days without commuting, without travel. You know, there are probably some other folks at your organization that can't do their job particularly well from home, but you can put them on the phones as well. Here's how to think about this. So one, call and just ask them to check in and ask for an update. So this conversation goes like, hey, we're just calling through some of our supporters, making sure you're doing okay. We also know that many are interested in hearing what our college or our nonprofit is doing during this time. Can I share some updates with you? You can just have a casual, welcome conversation there. At the end, you want to ask, hey, can we follow up with some ways that supporters or alumni, et cetera, can get involved? Many people have been interested in doing so. If they say yes, you now have permission to engage in a deeper conversation about ways to give or ways to help. So the second call, you're having a second conversation, and this way you're prepared with a couple of different avenues on how to help. This may include planned giving, but you may not want to only have planned giving for reasons that we've talked about, where it's a little bit more sensitive. but including it actually makes it more likely that people will do that. We know this is a little complicated, so on our resources page, which Simone shared and we'll pass along also to everyone who fills out the survey, we've created free phone scripts for you. So it's actually a 2-page long script to get a sense of what a conversation with a donor looks like in this context. It should be really powerful. We've already heard reports back of people using it and having a lot of success. So totally free for you, whether you're a FreeWill partner or not. All of these resources and all of these webinars are just here for you. And then some of you asked also, how do we set up a call? And so in the same resource bit, there's an email that we've designed for you, but I want to walk you through what that looks like in terms of setting up a conversation. Dear Linda, Linda's our hypothetical donor here. I wanted to reach out to see how you're holding up in the midst of this crisis. These are confusing and uncertain times, and as we grapple with the widespread effects of COVID-19, it's important to check in on each other. One thing to note here is that this is not you speaking as a big institution, it's you speaking as an individual human. So we're checking in on each other person to person, which is the kind of connection that will be much stronger in this. I'm personally feeling both hopeful and a little anxious as I work out of my living room next to a restless third grader. Now, what you're doing is sharing a bit about your own life, which builds deeper connection as well. People talk about friendship as gradually escalating vulnerability and sharing. I also wanted to let you know the whole team at XYZ Nonprofit and I are here for you. So a note of support and care. And let me know how you're doing or if you want to hop on a phone call to connect during this time of social distancing. So you're inviting someone to a casual conversation. This is the first step in that 2-part process that we discussed. So really important. This allows you to ask for permission to then make an ask that has been welcomed by the donor. All right, many of you are also expanding digital. And for some of you, most of your work has been one-to-one or event-driven. And so this will be a big shift. Here are a couple of tips on how to do this. So as we talked about last week, do not slow your planned giving marketing. We just showed that donors are more interested in hearing than ever before. We've seen a lot of feedback from partners that their outreach has been extremely well received. As we noted, donors have more time and attention. They're more focused on estate planning. And in the absence of events, this is key, you can increase your cadence of outreach. Why? Partly, it feels like time is moving faster. So emailing 3 days apart will actually have a lot happen in between. And 2, people are not doing as many things as they used to. So you have a more share of attention and you can increase your cadence as long as it's relevant and thoughtful. And just a reminder that helping you will make donors a little bit less anxious. So we could walk through all the types of emails you could send, but instead what we've done is actually created templates for each of you, and that is available on the resource site. We have something called the triple option email, which if you were here last week, we went into great depth. It's incredibly effective. Go check it out. We have emails for individual one-to-one emails to major donors. We have these with and without fundraising asks in case it's helpful for you. We have information to go to newsletters. We have virtual event invites and what we call resilience email, which shows how your organization is powering through. All of that's there. And a video email, which we've seen is already having a lot of success. And I'm going to walk through what that looks like right now. So a video emails we talked about last week, and we have step-by-step instructions in these templates. It's an incredible way to connect, and it can be quick and dirty. You don't need a video crew. You just need a phone. You need you. This is what it looks like from a museum. So we had to cancel our art tour, but it doesn't mean the show can't go on. So our museum curator is explaining the nuances of one painting. It's okay if she uses a lot of filler words. It's okay if the lighting's not great. This will be really interesting and a real way to show that you care about your folks. You can see who's clicking on the email and follow up with those people. This is a moment to build deep connection and to bring a lot of joy to people. Okay, a lot of you have asked, what if my organization isn't doing anything health focused? Can I still fundraise, and how do I feel about that? So I want to walk through a couple of examples here. So what do we do if our organization is not COVID-19 focused? Well, the core message here is that either you are doing heroic medical work on the coronavirus or supporting at-risk people, or you are persevering in spite of this. So let's pretend that you're a museum. Many of you may be. Here's what that might look like. As our museum is closed, our staff are working around the clock from home to continue to bring educational resources and experiences to the students and parents in our area who are stuck at home. So this is an example of, obviously museums are not going to do healthcare, but they're still trying to provide a resource in this context. As a college, you might say with our students off campus, our staff and professors are moving quickly to help ensure that their education continues, and knowing the uncertain world they will graduate into. And so you're pushing through and you're making rapid adaptations. That's the kind of information that's going to resonate very strongly with donors. And I added an example at the end from a land trust, which you might think land trusts are not necessarily the fastest moving organizations. They do incredibly important work. It's very unrelated to this. And so in that case, what you want to do is talk about how your team is powering through. Even in the midst of this crisis, our team at the land trust is continuing to work at full speed. Some of us have infants on our laps while we're crafting easements, which is a land trust term, while others are doing X, Y, or Z. And this is the kind of one-to-one or human-focused conversations you're going to have. I hope that's helpful. Someone asked whether we'll share the slides. We'll share the slides. These templates are also going to be on our resource page, and so you can copy and paste this. No need for attribution, no need for credit. Just hopefully this will help you do your work. All right, many of you have asked, how do we appropriately ask for donations in economic uncertainty? This is a great question and a really important one. I remember when we were fundraising during the financial crisis of 2008, 2009, we found some things resonated and some things didn't. And what our team really thinks of is this tactic that we call ask and acknowledge. So you should not stop asking for money because you need it. And there are people that can help. The challenge is that some people will be unable to help. You don't want those people to feel imposed on. So how do we do that? It's called ask and acknowledge. You want to ask and reference the challenge that some may have. So here's an example of what this looks like in context. When you're getting to an ask paragraph in your marketing, you might say, we know that some people are dealing with financial uncertainty in the moment. If you can't give, we completely understand. If you can, we'd love your help. Now, what this does is shows that you are being gracious and thoughtful to your population who may not be able to chip in right now. If you can, those people are thinking, oh, I may be in a more fortunate position than others. This is a moment for me to step up, and you'll see even greater giving from that population. The first category wasn't likely to give anyway, but this protects them from being off-put by your message. The second category is now more likely to give. And just to hammer home, we spent a lot of time last week on being a human in your messages. This type of messaging is more powerful when it comes from a human. So if you are a marketing manager, if you are a gift officer, and you're working from home, or you're feeling lonely, or you're feeling anxious, or your puppy's yapping while you're trying to write, add that to your message. That will make it seem real and authentic. If you are writing as the voice of just a prestigious institution, like the Met or Dartmouth or something else where people feel like this is an institution that's more powerful than I am, it might not resonate well. But if you are a gift officer at that institution, making the best of a moment, then people will feel connected to you. So it's more about the individual than the institution, which may not always be the case in your other fundraising, but at moments like this is especially key. Van says, thank you. No one ever gives environmental examples or land trust. Van, you're welcome. We're doing what we can. Caitlin asked actually briefly, what email platform do you recommend for adding video to messages? Well, we have step-by-step instructions, but for most people, what you want to do is just put a link to a YouTube video that you've uploaded. If you want to, you can do a screen grab or just take a picture, put that picture in the email, but you'll have to link out to it. That video won't play in the email in most cases. That's totally fine. Nobody expects that it will. Okay, so before we close, I want to talk through a couple of ideas that are not ours, that have come from the community this week. So just to share a few things of what people are doing around the country. I really love this. So someone wrote in, we wrote a casual email to our Legacy Society members that encouraged them to let me know how they're faring. This is sort of what we discussed. Suggested some great new shows coming up. They're part of a public television network, and shared a couple of funny stories from my own family social distancing. Got a lovely response. Many people seem to appreciate being checked on. This is such a great moment to build stronger donor relationships. Um, Other people said, we're increasing the use of social media beyond what we normally do, a post a day to engage our followers. This is as more people are online, and people forget that baby boomers are the biggest user of Facebook. And so when you're thinking about social media, don't think about millennials, don't think about Gen Y or Gen Z. It's really boomers who are looking at that stuff. Other ideas. This was great. This is coming from a college. We engaged alumni in making calls to their classmates if they're home anyway. This is especially true for retirees. And set up a special emergency fund for pandemic-related tuition assistance needs. So really cool idea from higher ed. We're using personal videos from email, which is what we've suggested. We're using short videos that show joyful aspects of our work so that donors can see it as continuing. This is really cool because people don't know that your organization is still going if they're working from home. So any proof that you can give, especially if it's fun and resilient, this will really resonate with folks. A few last ideas. We delivered quarantine baskets to the homes of some major supporters, which were very well received. This is cool, especially if you can do it safely. Just make sure you're complying with all reasonable local rules here. People are doing more emails and more correspondence. And then lastly, a virtual book club with a book selected by the dean. And these are great examples of creativity that's bringing people closer together, making the most of a moment where we have a lot of free time and a lot at home. So great ideas overall. And then the last thing, a lot of the questions we got last week was, this is great, but what does it mean for a K through 12 school? What does it mean for a land trust? What does it mean for a museum, et cetera? And obviously, we're not going to get to each individual sector on a call like this with hundreds and hundreds of people on it. What we are doing is really trying to find space for connection and brainstorming mutually. So starting on Wednesday at 1 p.m. Eastern, so 10 a.m. Pacific time, 1 p.m. Eastern, we're doing a higher ed roundtable. So if you're involved in college and university fundraising, our team is putting together some ideas from a bunch of the partners that we work with, but everybody's invited. So if you're in higher ed, this is a great way to spend some time with other people facing the same challenges. You can RSVP to this in the survey that we'll send out in a moment. So I know there's a lot in there. Sign up for it. We'll do very little talking there, and it's just a community event for people to do it. If there are other areas that want a community roundtable in animals, in environment, in faith-based groups, in civil and human rights, in community organizations, just let us know. And if there's sufficient interest, more than 8, 10 dozen people, we'll put together an event that allows space and discussion for that. We know you guys have tons of ideas. We know that operating a food bank right now is very different than operating an Ivy League institution, which is very different than operating a hospital. So we're here for you, and we'll help set that up. We've got the technology to do it and can make it really easy. So please add your name there. And that's it. So it's 12:45, at least on the East Coast. Summarizing what we went through today. One, expect a bunch of time before visits and events continue. You want to make a plan now so you can continue to hit your goals. You want to think about what that means for your budget, what it means for your staff, your strategy overall. We recognize this is conservative. There's a chance we could be wrong. There's a chance it could be longer. There's a chance it could be shorter. But you do want to prepare for the eventuality that it's a while. 2, there's a lot of stuff changing in messaging. A lot of people are uncomfortable, but there's some really strong best practices. Those are all available free to you. And donors are ready to be asked and want to help. People who are doing marketing right now are getting very strong responses. Not just people giving, but also just enthusiastic support. You can use this to deliver joy, use the ask and acknowledge tactic that we laid out here. It works really well, and you should see a lot of benefit from it. It will also make you happy to be able to engage more deeply with donors. And then the last thing I want you to take away from this is that this community has so many good ideas, and we will get through this together. So thank you for everyone who submitted ideas along the way. I know some of you are submitting them in chat. It's a bit hard to follow while giving the webinar, but really exciting to see, and I'm going to look forward to reading those later. Okay, next steps. First things first. Mentioned this a couple times. There's a survey in the Zoom chat. My colleague Simone is putting it in now. Please, please, please fill it out. This will help us make the best use of this time. and all the resources that you need. We'll do our best. We have webinars for at least the next 3 weeks to help you navigate through this quickly moving situation. At the beginning of this call, you could see how quickly things moved, from half of us working from home to everybody, from half of donor visits to everybody. By next week, we'll also have more results of real outreach that people are doing, so we can share those experiments and tell you what's working and what isn't. You know, some people will make mistakes, and we'll be able to save you those mistakes, and that's fun. And then 3, as I mentioned a few times, our team is here for you. We've got a lot of smart people working very hard on helping the nonprofit sector get through this, and particularly planned giving. If you need anything at all, note it in the survey. You can just email me at patrick@freewill.com. I will get it to the right person. So Simone is putting the link in the chat. Feel free to pop in questions. A reminder, the questions go in the Q&A button and not in the chat function, and I'll go through those right now. We'll do questions for about 5 to 7 minutes, then we'll pause. Anyone that wants to leave, no hard feelings, leave, and I'll stick around for another 10 or 15 minutes to answer more questions. Great. Okay, first question. So, where is the resources page? Simone has just pasted that in the chat, so go for that. I'm pasting the survey one more time. Okay. Sarah said, is now a good time to reach out to lapsed donors or merely strengthen existing donors? We would highly recommend reaching out to lapsed donors as well. You just have more time now to make more phone calls. And one of the really interesting things that came across in last Sunday's New York Times, actually, is how this creates significant emotional surges in people. And so behavior can switch now. This may actually be one of the most interesting times to reach out to lapsed donors. We'd strongly encourage it. Sarah, if you do that, let us know how it goes, and we can report back next week, but we think it's a very strong option. Amy asks, what are your suggestions if we are at the tail end of a capital campaign? The goal was to be done no later than the end of 2020, but that involves 2 major events, and I'm nervous that won't happen. So Amy, I would say first, starting work backwards is how might you get those gifts without an event? And that will be creative, but you may have virtual reunions. If you're a school, you may have virtual events. You can also just call donors and have, frankly, very authentic conversations with them. Hey, we expected that at this event we might be able to announce this. Instead, our dean is writing a letter to the whole student body or the whole alumni group. We'd love to include that. Can you make this pledge? And so start thinking about how to do that without events. Crystal, I will find it and I'll share it later. Someone asks, are you saying that instead of calling donors, we should email and ask to schedule a call? That is a great question. And it depends on the level of relationship you have with the donor. If it's someone you might call anyway, feel free to make a call. If it's someone who hasn't heard from you in a while, you can try it. You may want to call 10 people or 5 people and then email 5 people and see what the results are. Eva says, can you provide an email template or reaching out to lapsed donors? That's a great idea. That's something that we can get up this week. So check back on the resources page by the end of the week. Terry, any tips on doing virtual events? One of the biggest tips that we have is don't try to perfectly replicate an offline event. So think about what might be different or unique. One of the things that you might want to do is think about running a game show or a trivia where you can just have a bunch of participants in there. You might want to ask people to dress up and bring their own dinner. You might want to facilitate a roundtable discussion with the dean or an expert or your executive director just to hop on and check in. And in that context, where normally your executive director would be someone who's dressed up well and giving the stirring speech, they can still give that, but they can also be a human themselves. So if they're calling from their living room and they've got a puppy in their lap or an infant, if they've got strange art behind them, they can explain that. And actually building more human connection to your leadership at this moment is really key. That is great. There's a great question here. For smaller organizations grappling with cash flows, are there ways that you can ask board members to participate here? And the answer is 100% yes. So those folks that are used to giving, that may just be giving on their own, may be the best people to also make phone calls. What we'll say is that many board members are smart, accomplished people. They still may not be good fundraisers. And so you'll want to have a couple of sample calls with them beforehand to make that happen. This is a great suggestion from Pat. Just a suggestion. Orgs in New Jersey used to hold events like, I didn't run in the New Year's Day marathon, and you made a donation and got a t-shirt for not showing up. Everybody loved them. That's a really cool idea. This is great. An anonymous attendee said, we are moving our trivia event, typically a fundraiser and alumni engagement event, to a weekly trivia night for everyone, and it will be virtual. So that's really cool. We're actually doing that with a couple of friends, myself, and may do that for our team. And it's really fun. You can write some questions, you can find questions online, and people just will either raise their hands or can type in a chat, which is cool. And then Randy says, we're actually seeing some major donors give their annual gift earlier than normal to help. Would you advise us to share this option with other donors? If so, can you craft some language to pose this possibility to other major donors? This is a great idea. So two thoughts here. One is we'll help get some data, some language up that you can use. And if you have reliable donors, you might say, hey, this is an uncertain time. We'd love if you could front load your gift this year. The other thing I wanted to note is that if people have donor advised funds, and you've seen donor advised fund giving in the past, call those people. That is money that's already been allocated towards quote unquote charity, but hasn't been sent to a specific organization yet. This is the moment for people to empty their DAFs, or at least give a big portion out of it. And that's a very easy conversation because it's money that's not coming out of their own pocket. And then Danielle asks a question that says, our research lab is shutting down, and how would you advise that we fundraise during this moment? And I would just, I would be authentic and say, our lab shut down, we're making plans right now to get it back up and speed up research once that happens. This is more important than ever, please chip in. So being really clear about how it's affected you and the need that you'll have will resonate with people. Okay, let's pause there. I just wanted to say one more time, thank you to everybody who's come. I know you're working really hard. I know you have a lot of hard things in your personal life on top of your professional life, which is got thrown out of whack so quickly. And so it's just lovely to be here with you. And I hope that this was helpful. Please give us any feedback and anything we can do to help, and just let us know in the future. Looking forward to seeing you all in person at some point soon, hopefully at Plan Giving Conference or otherwise, when this is all over. I will stick around, so feel free to leave, go home, go back to your wonderful lives. But I'll stick around to try to answer another dozen or so questions over the next 10 minutes, just to help out a few more people. So thank you all. Let's give it a 20-second break. I'm gonna drink some water, and then we'll get back to questions. Terry says, I'd love to join yoga. Terry, make a note of that in the survey, and we will get you a calendar invite. Sarah says, will there be another webinar next week? Yes, same time, same place. We will also send you a calendar invite. Oh, Pilar says, do you support the idea of accepting a full tuition payment for a school a full year ahead? That is a great question. I don't know, but that's a great question to bring to the roundtable for higher ed, or if there's a K through 12 roundtable as well. Sean Michael says, we hold our annual Pride event every June. Out of an abundance of caution, we moved it to August. According to the timeline you've laid out, that may not work. Should we rely primarily on guidance from the CDC and local health officials to decide, or do you think being unrealistic in August Pride? It's not impossible that you'll have August Pride. I just think it's also quite possible that you'll have to move that back again. And so you may want to take that into consideration and certainly follow CDC guidelines over us. It depends on the population you have. If it's mostly a younger group, you may be a little bit safer. If it's older, you may not be. And so just keep an eye on that. Adriana said, what if we don't have an emergency to fill? Should we still ask for dollars towards operations? I'm afraid our budget will go low the longer we're away from school, especially for hourly employees. This is incredibly important. I would treat that as an emergency and share what you're doing to adapt, even if it's not healthcare, et cetera. I would go back a few slides in the presentation. We'll share the whole deck with you and take a look at the land trust or some of the other options as well in terms of using that language. James asks, how do I prove my worth and work to my boss during this time? I'm concerned about being laid off or let go due to budget. I would start talking to donors, and I would share some of the highlights. One of the things that can be really uplifting for our team, and presumably for you all, is hearing back about the conversations you're having. And so the way you highlight it is share with the whole team a few highlights of your day, of the conversations you're having, of the success you've had, and that will show how valuable the work you're doing is. And this is a real question in terms of how to show value, and especially for planned giving, which can be a little bit, sometimes it gets put by the wayside. Even though you don't want to be defensive. Instead, it's this moment more than ever is the time to be doing this. We just got a similar question that says, we haven't launched our FreeWill tool yet. Is now still a good time? And what change in messaging do you recommend? So our team will work with you on messaging. We think this is exactly the right time. You're seeing just this massive spike in estate planning and planned giving. And you want to make the most of it while people have time to make their plans. And so Simone is already offering to make sure the right team gets to you. But you can do this, and we have a couple of different templates, and then we'll customize them to your own needs to make this really, really effective. And we've seen it with other organizations. Okay, a few more questions. Thomas says, thank you for supporting us so well. You're doing a fantastic job. Thank you. That's not a question, but I appreciate it. From San Diego, we're getting a question. Our gala committee is looking at ways to do a no-go gala, wondering what the expectation should be for the income. Obviously, taking into account the cost to host one will be a lot less. So you should be able to move your costs down very low. We don't know. This hasn't really been tried. One thing I would do is allow people a bunch of different ways to participate, and then also potentially note that you're gonna honor these people to a special degree next year in person if that's what they're craving. And so you create this sort of special society or committee or group who is standing up right now, and make sure that they're honored the next time you're in person as well, and that they know that will be true. Linda asks, can you provide some templates for do not come events, especially invitation language? That is in our templates. We'll make sure to go check that out. Janelle says, what would your response be to DAF donors who are reluctant to make grants due to the decrease in the value of their funds resulting from the stock market performance? I would say, A, we don't know whether the stock market's going to go up or down, but B, this is really the most important time for you to be giving. And so even what you say as an executive director is, look, $7 now is more valuable than $10 next year. And so even if you expect it to go up, this is still the right time to be giving. How much are people changing their messaging? For example, we have heard from a few donors that they can't focus on international work right now with COVID-19 being so widespread in the US. That will be true, but I think you can talk about how it's affecting vulnerable populations and how so much of, and you can actually articulate the risk that other people will ignore these populations, and so this gift is needed more than ever, right? One of the risks of donor distraction is that very important causes that are not coronavirus don't see the attention they need, and you can actively name that dynamic that's happening. Okay, let's take two more and then maybe we'll wrap up. What can a development director provide to a financial director of a nonprofit to help assess the organization's resilience and financial planning? This is a great question, Lynn. We'll have to get back to you on the right tools there. Okay. This is a great question. How are others processing donations that are coming via checks, like the usual donations from donor advised funds? This is a real challenge for a lot of nonprofits. Right? Mail is coming to your office, no one's at the office. It is not unreasonable for one person to go in with gloves and protective equipment. If no one has been in the office, it should be a relatively safe area. But you may also just want to say, we're going to wait 2 weeks. But this is something that certainly our organization faces, and making sure that someone's getting the mail is really important. I'd be curious to know if anyone wants to chime in on how other people are handling this. Someone says the post office is handling their mail. Someone else says we have a lockbox for donations, and so these are a couple of options. A hospital foundation, all of the gift processing staff are on site. And then someone else is having all their mail forwarded to one colleague's home, which is also possible. So Lynn says we have one person go for mail, then scan it to those who need to know. Someone else says we have someone go in once a week. So really great, great feedback from everyone else. It's really nice to have this community around. All right, let's wrap up there. We'll go through the rest of the questions, and we will make sure that that's included next week. So thank you again for everyone who stuck around. There are 200 people still here. Thanks for all the hard work that you're doing. Good luck this week. Let us know if you need anything, and we'll see you next week.